Good morning, good afternoon, good evening, everybody. I'm back, Dr. Unati here. Today, I'm coming back with your usual faces here. You know Dr. Sola. If you guys don't know Dr. Sola, I'm going to introduce him to you guys shortly. But before I do that, this week was my birthday. I turned 40. And please stay till the end. Thank you, Doc. Stay till the end because I have 40 giveaways. So you don't want to miss them. Please stay till the end. I've been thinking about this year, Dr. Sola. We've been talking about this also in the background, how 2021 we could probably change our mindset and basically adjust and adapt to this new 2021 and also to this new life that was given to us last year. And I think a lot of people are still saying, I can't wait for the normal. There will never be any normal. This is our new normal. So today,
Absolutely.
yes, today I'm bringing you to kind of empower our kings, because I think a lot of times we tend to forget our men. So today I'm bringing Dr. Sola. Before we start, I'm going to introduce again Dr. Sola. Dr. Sola is our regular face here. If you don't know him, he is the Chief Executive Officer of Grace Insight. It's a big company in UK and Nigeria. He works with companies, corporate, and actually private, and basically every organization willing to improve their mental health state. And of course, he looks at holistic person. You know, a lot of times we tend to focus on the disease. His company is quite unique. He looks at a person holistically. I'm so grateful for what you do and your team, Dr. Sola.
Thank you. Thank you.
Thank you so much. He's actually a psychiatrist in the UK. He works in the UK and in Nigeria, as I mentioned before. He's also a forensic medicine specialist. Thank you so much for coming along today. Happy New Year.
Welcome. Thank you. So much.
Thank you. Today, we're actually talking about a topic that is very close to my heart, depression in men. I love this topic because I feel that our men in the world, they are so affected by depression, but not many people talk about it, more especially in terms of going deeper and helping our men. If you look at the stats out there, who is mostly in jail, who is mostly involved in GBV, who's also committing suicide, homicides, it's mostly men. And all the societies do, they complain about men. But what do we do to empower men? Today, we're going to soon find out from Dr. Sola. He's going to empower us. And I'm so happy there's many people coming in. Thank you so much. Join in, share, and invite more friends and families. Today, we're going to talk about depression in men. And I'm hoping we're going to leave transformed. More than anything, we're going to leave with a different perspective of looking at men at a deeper level. Dr. Sola, I know that you have goodies for us. Tell us, a lot of times people don't realize that they are depressed, more especially men. As you know, they kind of sometimes present differently. Do you want to share with us today, what is depression in men? Because sometimes people downplay their symptoms. They don't realize they are depressed. I would like us to actually, you take us through that on that.
Okay, thank you very much. Thank you. It's a pleasure to be here. And you know that every time you've asked to come, I don't even think about it twice, because I know there's still a lot to be done in terms of mental and emotional well-being in Nigeria, Africa as a whole, and the world at large. And even considering the last year we've all experienced, cases of mental illness and emotional problem are rapidly on the rise. So we can't do too much. We need to continue this awareness and educating people and encouraging people to identify the early warning signs, understand that this is no respecter of anybody, the rich, the poor, the young, the old, anybody, male, female. But today, I know we're focusing on our wonderful men. And it's with the year, there's been a lot of job losses, there's been a lot of instability, there's been a downturn in the overall economic status of the world as a whole. All these are factors that can affect people's emotional and mental well-being. And I'm going to narrow it down to the African man, to the black man. And the conception we have about ourselves as, we call ourselves the head of the family, the provider, the one that needs to make sure everything is fixed, the one that primary responsibility is to put food on the table. I know the rhetoric is changing. We are equal partner with the women, but that is the theory of the African Black person, that the man needs to do this. And with the year we've had, a lot of men has not been able to really live up to that because of job losses, because of uncertainty, employment, because of instability generally, lockdowns and things. This has affected men in a very... I've spoken to people, they felt hopeless, they felt disempowered, they've not been able to do their husband duties, fatherly duties, and this has made them feel worthless, feel less of a man. Even I'm talking about people who have previously had a stable mental state. You get what I'm saying? With all these new experiences and occurrence, it's taken a huge downturn on them. You know, a lot of people have directly or indirectly suffered loss. People, relatives, colleagues, friends have passed away. And this has put a whole new perspective into how people are thinking about their lives, what is important, what is the real essence of life. And this has gradually tilted a lot of people towards going into depression. So today, it's a bit of a shift from what I would normally talk about our depression, which is standard persistent low mood of 2 weeks or more. And but now things are changing, and we need to constantly be reviewing and be dealing with the latest evidence. You know, you see a young man who's out of job, you need to look at depression might be something down the line happening. You look at relationship breakdown, you know, like depression might. And how do people cope with these things? People are turning to drugs. People are turning to alcohol. They are socially in fact, they've told us to isolate anyway. They're telling us to lock down. So there's no social connectivity. People are not able to key into things that they've enjoyed. You know, they're not able to call on their coping strategy. Coping strategies has failed them. You know, it's personally, I'm sorry, I'm going on. I'm very passionate about this thing.
I know that. You go ahead. I love it. You know, I love it, Doc.
You know, when I look at my patients that have got established diagnosis, even before COVID and all, that have got established diagnosis of depression, then COVID came on top of this. And at the first wave, we were telling them, no, we will go through this together. We are in this together. This is just a phase, it will pass. You know, let's key into our relationship. But, that was when I was seeing them in April. Now they came to see me December, January. Oh, Doc, you said this was a phase. This is a very long phase. You know, it was like egg on my face, but I just had to dig deeper. And again, I lied to them that life has to go on. We have to find pleasure in new things. Even we have to find our happiness. We have to know that the feeling of happiness is a decision. You have to decide that you want to be happy. You will not let external factors, what is happening around you, you won't let it determine your innate feeling and your emotions. Yes. You know, so that's the current situation with my practice at the moment.
I know. Same. Here's the interesting thing about this COVID-19. The sad part is, as Africans, we are a very interconnected unit. We always together, we do things together. Here's the interesting thing that has happened during this COVID time. Now there's burials every day. We are burying our families, our colleagues, our friends. But then now we cannot be there for them. There's no time to grieve. There's no time to grieve. Now, like you said, people who were previously well emotionally, how do you not get depressed in this stage? Because you are burying your mother this weekend, and then the following weekend it's a brother. Like, I mean, I've had families telling me that they've lost 3 members of the family within 2 months. How do they cope in that? So tell me, Doc, what must people do at this point? Like you were saying, your patients are asking you. You said we must keep going. How do we hold on to? We are here in this together.
So this is how I normally start with and I say, at the beginning, to a lot of people, these were just numbers of deaths and how. But these numbers are turning to faces, are turning to people people that are close to you. So how are we meant to, a lot of people, their coping strategies are failing them. But again, we need to stay grounded and reflect. We need to stay grounded and reflect. I just tell them that, okay, look at where your life was pre 2020. Look at 2019, for example. What did you used to enjoy? What were the things that was important to you? What was that thing, that huge protective factor that you felt was still worth fighting for? And then look at now. Try to identify those things. Journaling, be grateful, count little victories, celebrate little things. The fact that we are still here, we still have a roof over our head is worth thanking enough. We are not better than people that are no longer here, but the fact that we are here, that means we still have a purpose. You know, you let people key into their faith, into what people that are still, you know, people have faith. People are Africans, we are really embrace our faith. And a lot of people do get a lot of comfort in reverting back to their faith and understanding that they need to remain grounded. They need to remain grounded. Okay, then I go step further and tell them that what is the option available? The option to you is for you to start getting worried and become anxious. And then on top of this, you develop anxiety or you develop high blood pressure and physical health things. You need to stay grounded by identifying that there are some things we can't change. COVID is here. Leave the scientists to do their work and get a cure. What can you do to make sure you are in a stable state? Keep to the guidelines and hopefully this would pass. That is all what you can do. You need to accept that some things are out of our control. So there's really not a lot of point worrying about it.
Yes, it's out of our control, Doc. You know what? As you are talking, I'm just thinking about the symptoms that we could easily miss in men, because we both know that men can present slightly different. Do you want to touch on that so that people can actually help their men in their lives, either a son or a husband or a brother? Because, you know, as you know, men, they can be very aggressive when they are depressed. You know, I would like you to touch on that so that people can know and be clear and seek the help they need.
So, first of all, withdrawal, they might withdraw into their shell. Okay. Secondly, there might be overall change in behavior, things that they don't normally do. They might present with some avoidance symptoms. They just don't want to avoid conversation. They want to avoid any form of interaction, and deep inside them, they might think this is my way of managing the situation. They say that is my way of coping. Gradually, they are drowning themselves and they might get overwhelmed with negative thoughts. So, unspecified pain, unspecified pain. You see some people just say back pain. Oh, I'm just tired, fatigue, lethargy, poor sleep, worrying, excessively worrying about things, and unfortunately, people can take up unpleasant, bad habits.
Yes.
Yes, and as human beings, we tend to think we are always rational and say, "Oh, that is my way of coping. That is my way of coping. That is my way of coping." But there are good ways of coping and there are bad ways of coping. You understand what I'm saying? By the time you start coping with negative things like drugs, like alcohol, excessive late night scrolling, avoidance of conversation, and not being intimate with family, a lot of things. So those are pointers that there might be a big problem looming.
You know what, Doc? It's interesting you are mentioning that during this COVID time, I've been so proud of my male patients. They came out and said, "Doc, we need help." Like you were saying, people started showing the symptoms of more excessive alcohol intake. We've seen a rise in people who are overdosing on other drugs. And I'm quite proud to say that my male patients, even those that never really came before 2020, who complained of depression, now they have reached their saturation point where they said, "You know what, I need help." So somehow when we look at this 2020 and COVID-19, what it did to us, we could actually look at it positively, that it has pushed men from their comfort zone to kind of come out and say, "Hey, I need help." So I've been very proud of them. When I look at the stats, more men, of course, women, they're always able to kind of come initially, like when things are starting. Men, you tend to downplay your symptoms. So I'm very proud to say I've seen quite a rise of men seeking out help. And also, I'm proud of what's happening in the world, the organizations. There's a lot of organizations now talking about mental health, which I think is going to help us Black people to also own our emotions. Why is it that in the Black communities, we always feel like we are strong? This is also in women. Women, we also kind of keep going. Me, as a Black female physician, sometimes I kind of catch myself going to work while I'm feeling unwell. And I'm like, why am I going to work? I'm not well. How much more for a man? Really? Why? Where is this coming from?
Yeah, so I can tell you 100%. So growing up in Nigeria, we were trained, we were used to not talking about emotions.
Yeah.
You know, not even feeling low or feeling happy. We were just trained to get on with life. If life throws you this, get on with life. The idea then was to build up our resilience. But we left out the affection side of things, the emotion side of things and things. Growing up, my parents are fantastic, but I never really saw them kiss each other. I never really saw them hug each other or express any form of deep affection and things like that. You get, and then transcend that. I tend to look at, maybe this is an abomination. Maybe they're not meant to really kiss, or or they're not really meant to, or maybe they're not really meant to talk about emotions. And that is what fed into me. And a few times that I've probably said, oh, someone had called me this name in school or done this, and they will look at you with funny that they called you that name. Did you call your own back? Or what was the big deal? You know, that has been the way we've been growing up. Now it's time we're just trying to change the rhetoric, but it's not going to be a day's job. So the idea is that our baseline is that we don't talk about it. You get on with it. And you know what? If you now talk about it, you will now see the person that will say, is that what you are going through? Your own is small. You don't know what me I'm going through. So there is a culture of people downplaying people's emotions and symptoms. So that culture, that stigma, we need to bring it. There's no award for the person that has the most problem or for the person that... Exactly.
Wow, there is no award. Less pain is pain.
Exactly. And it has to be validated. You have to hear anybody tells you, so you don't tell people feeling low that they need to get on with it, or they're saying feeling suicidal, you need to say, don't be a coward. No, you've not walked that person's shoes. You've not experienced what they have experienced. If you don't have anything nice to say, you keep quiet and just say, just don't say anything. You get, so that is why, that is what has discouraged a lot of people from speaking out.
Yes.
You know? And again, you know, I said that we are very religious. A lot of us are at church, and I believe we are strong, we are workers in church or mosque or things like that. What will people think to say, oh, you that's something? Why you talk? You can't be talking about it. You are the one that is meant to be the motivational speaker. You are the one that is meant to be pumping people up and encouraging people. People must not see you to be crying. Yeah, you must not see you, you know. Exactly. So there's a self-perceived stigma, and there's a community stigma as a whole. Those are the things that prevent, and this has a bigger effect on men compared to women.
So much.
Because we have given ourselves that crown as edge of everything, you get. And then when we are not able to live up this thing, we won't be able to say that we need help, and then we'll be suffering it. And again, for men, there is the perception of the community perception of success.
Yes, I would like you to touch on that. Before we do that, Doc, I want us to talk about men who are in positions that unfortunately cannot feel their emotions because of those positions. How many pastors we've had committed suicide? How many pastors committing suicide? Or how many pastors are involved in gender-based violence? Or homicides? You know, I would like you to touch on that, because a lot of times we tend as a people, or let me talk about us Black people, we tend to associate power with maybe wealth and is equals to all is well, which is not always the case. A lot of times those people are struggling. I've had people even in my communities like LinkedIn or like in the social handles, people will say to me, you know what, the status I have in the society Now it's gonna be like, I'm weak to come up front and say I'm struggling. And this is not only Black men telling me this. This is across board. You know, you go ahead, Doc. I honestly would like you to talk about those places because there's a lot of depression there and people are not talking about it.
Yes, absolutely. And what comes to my mind is the famous saying, the rich also cry. So that's, you said it at the beginning, mental illness is not respecter of anybody. The very rich, the very poor, the middle class, the powerful, the people, it is not respecter. But, you know, with all this high position and societal perception of success,
Yeah.
there is some unwritten expectation that you are meant to be the Superman and all. And then we then find ourselves as human beings in the position that I cannot now come down and seek for help. What would they think about me? Do they think, does that take any power from me? Does that take any percentage out of my success? Or would people now start making stories up about me? So the most important thing I tell people is that individually, you have to come to a realization that you have to be intentional about your emotional and mental well-being.
Love it.
You know, if you don't come to that realization, insight is zero. And I always say it's zero. It's zero.
And I think we need to also learn as a people that how I feel, I need to feel that. It doesn't matter how the second person perceives it. I need to feel, this is how I feel. And actually, I would like us to challenge parents here who have boy children to let them be vulnerable. We need to stop naming them names, giving them names, how weak they are, if they are showing their emotions, because there's actually an image that is still clear in my mind I saw on social media where a mother spoke so harsh on the boy who was expressing his emotions at the time he was hurting. And then unfortunately, that boy closed right there. And then when these boys grow up or this man grew up, what happened? He's a closed, emotionless. He can't show affection to his partner, like you were saying before. We need to be mindful. And also as parents, we need to be mindful parents so that we can let our boy children live the same way as our girl children. We have the same emotional tanks, right?
Absolutely. Right. I'm just keen on what you've said about the male child, young, because these young guys are those that will go to become adults in future. And it is very, very important that parents give them that space to be able to express themselves, talk about things. If they want to cry, they should cry. If they want to talk, because the flip side is if they shut them up or if they don't validate any of those feelings, they're going to lock up. And once they lock up, they are going to go and seek compassion. They're going to go and seek empathy, seek validation in the wrong places most times.
In the wrong places. You know what? I remember working in the mental health unit in South Africa. I had a group of young men, like young boys, 15, 16, who were abusing the cannabis, the benzene. There was a popular drug in South Africa called benzene. I'm pretty sure it's still there. As we both know, a brain of a person matures at 25. So these kids, I could not conduct the classes I wanted to have with them because they were mentally not there. The cognition, they could not be there with me. And the sad part is, how do we reverse these things when they happen? So truly, we need to be mindful parents when we do all these things, because a lot of times now our children, there's phones that are available to text and find that little cure they could get from a friend who has the money to give them. So we need to be very careful. Doc, I would like us to actually talk about now when men and boys have all these issues, who do they talk to? Because sometimes men struggle even speaking about their emotions to their wives. They feel, like you said, sometimes it's the self-sabotage. Before they even talk about it to their spouses, they don't talk about it because they've already had those negative thoughts against themselves. And then, of course, there's a spouse that will also mock them sometimes. Not all the time. Who do they talk to? Where can they be vulnerable?
Okay, thank you very much. I will answer this second, but I remember something when we were talking about the last point, when we were talking about the addiction and drug abuse part. I'm sure a few people might be wondering that, oh, the topic is depression and why did we drift into drug abuse? I just wanted to tell people that, you know, people who go into addiction and all these drugs, alcohol, excessive alcohol, they are trying to suppress a feeling. They are trying to numb their low mood. They are trying to, so it is a coping strategy, negative coping strategy for people who might be experiencing low mood. And you hear that they say they want to drink away their sorrow. They want to numb one kind of feeling. So that is what tilts people. Depression could tilt men or women into addiction. So that is why they are so closely linked together. So imagine if someone that is saying, I want to drink away my sorrow. If he was identified at that time where he was sorrowful of feeling low mood and given appropriate intervention, then the individual will not go towards drinking. So back to your question, that's I just wanted to touch on that. Then go on to who did they speak to? Who is this trusted person? I normally say identify a trusted person. Now, who is very difficult? Who is there to trust? You know, when you hear loads of stories, you hear a lot of things that have happened in various religious organizations. You hear a lot of things that have happened in the hostel, boarding school, and things on. Where is this safe place? I must say everything comes back and starts from home. It has to be from the home. It has to be from the home. That home has to be a safe place, safe haven for young men and even adults. They should be able to be in that space that they'll be able to talk to their spouses and open up about every little thing or every big thing. And children also should be able to open up and talk about these things. So that place should be the first place. But saying that, I know that there are some people who are not as lucky as some who do not have that home. We need to have them in mind as well. There are some people who are either homeless or in foster carer or in, so they need to identify a person who they think is trusted in wherever setting they are and gradually open up to the person. People, it could be the if they have a welfare officer, a principal or whatever, an elderly person that I'm not saying it's 100% that we safeguard proof, but not talking is very, very dangerous. So people should try and identify a trusted person that they can speak to. And if you are an adult that is listening and say, oh, if someone comes to tell me that I'm feeling low and I don't know what to say, what will I do? You know, that's a valid question. We are saying talk to a trusted. Okay, what will I do? Well, for you that are listening, if you don't know what to do, first of all, showing of empathy is doing something. Listening attentively. Listen and let the person talk in a non-judgmental way. In fact, you have done 30% of good for the person.
Yes, because it is letting that person to be vulnerable and to feel free to be himself, right? You know what, Doc? What you just mentioned is taking me back to yesterday's conference. We had a beautiful conference with the community in Ghana where we had a discussion on men's urogenital system, basically how to take care of it. And you know, that's another thing we don't teach boys.
No, we don't.
Right? So it's something that we want to do every year. We want to start having these conversations in Africa. And we had one of the guest speakers, there was a man who had a history of surviving rape. This is another big giant we're not talking about as African people. A lot of young boys and men are living with an untold story of rape. And it's causing so much pain. It's causing so much grief inside them. They are not talking about it. They've never talked or never shared with their parents. And today we wonder why people, they are either addicted to drugs, like you said, or they are saying, I'm depressed, I don't know why. It's because they have this untold story. They've never shared. And it's interesting how this man said, after he shared his story on BBC Africa, men from all over the world, CEOs, all levels of social class reached out to me and said, I have the same story.
Wow.
So this is another untold story in the African soil or outside Africa. A lot of times our men are going around with untold stories of sexual abuse. They've never shared. It could have been an uncle, it could have been a cousin, it could have been a family friend, because it's usually a very close person. Do you want to say something about that, Doc? Because
yeah,
honestly,
you know, when you were talking, I wrote down something in my book. I wrote taboo. You know, talking about it, they see it as a big taboo. You know, it takes me back to what I mentioned earlier, that why there's still a lot of stigma about talking about emotions and things like that, perception of the community. Imagine if that guy had gone to tell someone that, this is what happened to me. And unfortunately, that person has now gone to tell another person, and they tell another person. And then this individual might be ostracized. Our community back then, and even up until recently, is not clued up to manage those kind of information and to encourage people to express themselves, to let them be comfortable in sharing their experiences. And there's another slang that goes up, man up. A lot of people say man up. You need to man up.
Yes. And it's not only in Black communities, it's across culture.
Exactly.
Man up, it's perceived as you are weak. Where did this come from?
Exactly. Yeah. Imagine this guy had shared his story back there with his friend. They would laugh at him, and they'll say, "No, man up. Oh, you want to tell me you didn't enjoy it? I wish I was in your shoes." The people we speak useless comments, very, very inconsiderate comments, and what we don't know is that all these things, how is it affecting the individual involved? How is he coping? How you are neglecting that this must have been a very traumatic experience for this individual, for you to be subjected to something against your will. Again, yeah. I wish this has similar amount of attention the way the female issues too does, but because men has portrayed themselves over the years as the super energy guys, and it's not like that, really.
It's not like that. And you know what? This takes me actually to a book I'm reading about inherited family trauma. We tend to underestimate what happened to our forefathers. We've never met. And us, or these people downplaying these rapes that people are coming out to share, the sad part is it's something that could actually affect them also personally or in their kids if we don't let people have that clear space that is safe for them to express themselves and also heal from that. The sad part about inherited family trauma, this could happen to this young man's children. And it goes on as a generational thing. And that's when we start talking about generational curse. And you know what, Doc? I would like us to actually talk about what has come out in the mental health studies, that this inherited trauma that could later cause medical conditions. I was surprised when I read about the adverse childhood experiences, how these things, like in Africa, we both know people are exposed to poverty, people are exposed to wars. There is gender-based violence in the families sometimes. Some parents, they divorce and separate, right? There's exposure to mental health illnesses that people are not even diagnosed. And then they're told later on, you can develop diabetes or chance of developing depression from that. So these are the things that we need to start bringing up to the surface so people can see the bigger picture. Right?
Yes, you're right. Absolutely. I wish there could be a retrospective study going into people that probably grew up maybe between the 1980 and 1990 that were born in Africa, and to just find out of what people went through, the kind of deprivation and the kind of poverty. I speak to people and they say, "Oh, when I was growing up, we didn't have milk and we didn't have sugar. Now they want to eat a lot of sugar. They want to put a lot of sugar in them." And, and they say, the poverty that I experienced. And again, it again goes to say, people will say, the poverty that I experienced growing up, I don't want my children to experience it. So that now they then start to overcompensate.
Overcompensate.
Yeah. Exactly. Yes. For people growing up in that grew up in places that are socio-economic, there is no sugar, there's no things like that, there's no Coke, and there's no things like that. And now they are able to afford things like that. they will probably make up their mind that all the suffer I suffered, my children will not suffer, and they want to give the children chocolates every day. They want to give them Coca-Cola every day. They want to, if you look at the way they are thinking, yes, they want the best for the, but a balance needs to be maintained, and this is being fueled by their own adverse experience.
Yeah. So we need to heal.
Absolutely.
Powerful, because a lot of times parents, they're doing it out of, honestly, out of joy, but now I've overcome this. Now I'm gonna give, now here you are, you give your children all these things and then increase the risk of developing diabetes and obesity. And let's talk about obesity in boys.
God.
We are seeing kids now with high cholesterol because of the stuff we feed our children. And of course, social media is not helping us. The media, the stuff that is out there, the high sugar children have, the dentists are out there educating the public to take care of the teeth because of how much sugar we give our children.
Absolutely. Yes. And for anyone that is watching who is thinking, what has obesity, all these things we are saying has to do, I will explain what the link is with depression. So, Mr. A or Mrs. A eats a lot of sugar, is diabetic, is overweight, and probably used to be a size 14, gradually crept up to size 16, went to size 18, and then overweight. Clothes are not fitting her the way she would like. She loses confidence in her appearance, and her emotion and self-confidence and self-esteem goes down. There might be name calling, there might be a lot of things. And all this would have effect on his or her mental state. So that is it. And it's not even the adult, even the younger ones, And again, if you look at the other side, we have a lot of bad, not so good role models here now are by there that these young ones want to be. They want to be size 0. They want to be this. Yes. They're not able to meet up with that. What consequences or what impact does it have in their self-confidence, self-esteem? All these can tilt people to depression. So that is the link. And I know that even if you go, we are always going to link all these things together.
Yes. You know what, Doc, though? Please mention the boys and the men. What we see in our practice, how men also perceive themselves when they are overweight or they are obese. Because sometimes we think the impact is higher on women. The men that come to me lately, I've been treating. And by the way, obesity, for viewers out there, obesity is treated now like, like any other illness. It's like high blood pressure, it's like diabetes. We literally treat it. If you have some weight issues, please go see your doctor. There are medications to treat overweight and obesity. We are starting to see men wanting to use the testosterones, those synthetic testosterones that are not good for their health because of how a man is perceived to be, right? We see a lot of pressure also for men, and that kind of takes them to depression. A lot of men, my patients that are taking all these steroids from outside prescriptions, they are saying it's because there's so much pressure out there. This is how a man is perceived to be looking, all cute, or how handsome is perceived by the world. It's not only women. It's sad. Men, like social media, like Instagram. I saw a latest article talking about how even men are getting depressed by looking at these men that are showed in the social media handles. You would think it's only women. It's also men affected.
Absolutely, you're right. Absolutely, I can agree less. You see men even going for all this tummy talk and all these things now, just to make sure that they have the six-pack or they are. And again, don't forget the impact of obesity, diabetes on libido and all those sexual functioning and inability. If you're not able to satisfy your partner sexually, how would that affect your mental state and your further perception of the ideal man? And how does that affect or link into stability in your relationship? So all these things, in fact, the physical health, mental, they are all interwoven. And weight, obesity, diabetes, they are very, very key things that could link people to becoming suicidal, very especially in the world of nowadays.
Yes. You know what? I'm so happy you're mentioning this interconnection of these illnesses, because truly diabetes, and I always, when I share with my patients, any man who is 40 and above, unfortunately, as something that is inevitable, has a higher risk of developing erectile dysfunction. All we need to
Exactly.
do is to educate the men in our lives or our patients or the people in our lives who are males to make sure that they look after their health, making sure that you look after that weight, the diet you're eating, the exercise, and also paying attention to how you feel. Also, how you feel. It's important to go seek help when you feel these emotions. Doc, I know that we're talking about how to go about all these symptoms. And then, of course, we talked about also the causes. You want to also talk about the other causes that men need to pay attention to? Because I know that sometimes people don't even come to ask for a physical examination. And then this is when we catch things like thyroid disease. Do you want to talk about other causes, please?
All right, so there are other things that could make people low in their mood. So first, the commonest causes is when you have low blood level, you could be tired and you won't be motivated. You might just have symptoms that are similar to that of depression as well. And thyroid, abnormal thyroid function for hypothyroidism particularly, it could make you lethargic and less motivated. And when you are tired, then all these things, all these similar symptoms, you will not be able to do what you normally do, or you normally enjoy. There might be problem with your sleep. Insomnia as well. People who are deliberately probably taking stimulants, Red Bulls and things. I'm not saying they're not good, but minimally, coffee and things excessively. This could lead into insomnia, and in the presence of insomnia, then you're just wide awake, you're not refreshing in the morning, you're not able to function. And again, you know, when I talk about these things, I say a lot of people experience some symptoms and they still manage to cope. But when your day-to-day function is impacted, then it becomes a big problem. Yes. It becomes a very, very big problem. Some people say, "Oh, I just sleep for 4 hours." Oh, and they ask me, "Is that a problem?" Ideally, I would prefer you sleep in a bit more, 6 to 8 hours. But if you think you function on 4 hours, then but once your day-to-day functioning becomes impacted on that 4 hours and you don't make time to have some catch-up sleep and things like that, then you need to look into it. So yes, all these things are very, 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 very important for anyone listening to us who might be feeling low in themselves or feeling symptoms of poor appetite, lack of interest, not enjoying anything, poor sleep. Please speak to a professional today, your doctor, who will be able to check you out to rule out any physical causes first. And if there are no physical causes, then most likely it's a mental health problem, and then you can get appropriate help promptly.
Awesome. Thank you so much, Mike. And then, of course, I want us to know, how do we treat this? You know, people are probably wondering that, okay, how do I get the help? What am I going to do next? Now I know about this.
So help is readily available, depending on where you are. Okay, no, before I talk about availability of help, let me talk about what the help is. So for depression, the first line of treatment is psychological intervention, which we call therapy or counseling in the layman's language. So people to help you understand why you feel the way you feel, and then change the way you perceive things. That is the core concept of CBT, cognitive behavioral therapy. So with the background knowledge of understanding the fact that the way we think, feel, and behave is what predicates our day-to-day living. So psychological intervention, they are very, very useful. They are very, very effective, evidence-based. There are various types, and most people would get good outcome from that. And if that doesn't work, or if there's significant risk to self or others, or when there's increased suicidality and stuff like that, you might want to consider pharmacological intervention or combination of both antidepressants, and they are safe. And a lot of people ask that when you're using this medication, is it forever? No, it is not forever. For most people, just follow the advice of your doctor. Some people might just need to take it for 2 years, depending on how they cope. Some people 1 year, but the doctor needs to be reviewing it regularly. The advice is, do not stop any medication without doctor's advice. And also, before a medication is started, make sure that you go through advantages, disadvantages, possible side effects with your doctor, so that you make sure you're using the right one. They are very, very safe medications. There are a lot of medications that are prescribed regularly, so there should not be stigma. For people that have questions about medication as well, I tell them, why are you happy to take paracetamol and you don't want to take sertraline? So I don't know, both tablets, or why is the stigma? Why are you why are you having a stigma around men, depression? About headache is fine. Why are you happy to take your antihypertensive and you don't want to take your olanzapine? What is different? I didn't know both tablet. So, and why are you asking for people who are hypertensive that they know that most likely it's going to be lifelong? Then why are you happy to take that and you keep asking me when am I going to stop my antidepressant? Why don't you just accept that you will only stop it when you are stable?
And how of our functioning is our mental state. How
exactly.
do you show up? How do you function at work if you are depressed, if you are unhappy? Because today we have people that are grumpy at work, that are mean towards other people at work because of how they feel inside. Because a lot of times there's a saying, when we are hurting, we hurt others. We're bleeding to people who never cut us. So sometimes it could be something like that. Or sometimes you just need to deal with that pain that you had gone through in your life. Thanks, Doc.
Absolutely. Then go to the other side in terms of availability. And this is where for the first stage is awareness, what we're doing to make sure that people understand that this help are real life things and stuff. And then where do they get help? Availability of help. We can talk from now to tomorrow on the need for funding in terms to a lot of mental health services so that there will be availability. And when we talk about funding, a lot of people might think funding in terms of technology. Yes, that is good. But funding in terms of grassroots, educate all these our community health workers, educate people that have direct contact with people in villages so that they can talk to them and they can jointly eradicate this and know that mental illness is not a death sentence. People get better. So there has to be funding so that awareness has to be across all levels. Religious institution, road transport workers, everybody should come on board and educate these people. And then they will be able to, once they are aware that this is a problem, then insight is golden. Once there's insight, then is a step towards getting recovery. Then you can assess your local support in your network. And Mr. President, you have a lot of work to do as well. Black mental health matters. We need to extend our coverage, our outreach to all these local places. I know it's good we're doing this online. What about in villages that don't have internet?
Yes.
Who is talking to them?
You know what? It's actually part of what we are planning for the Black Mental Health Matters. Thank you so much for mentioning that, Doc. And with you being part of the team, we're going to do great things for our people. And like you said, we're not only in this space. The people that need this more, they don't even have access to this. But we are hopeful that as we share this and as our viewers constantly come back here, they are learning and they are sharing. We are hoping that they are sharing with their loved ones at home. So thank you so much for mentioning that. Now, before we close, hey man, the time is going so fast.
Wow.
Doc, what nuggets can you give people here, our men who are struggling right now with depression, who are scared for living? Because a lot of times people who are depressed, they are scared to face tomorrow, right? And what can you tell also the families that are living with this man or this boy child who has detached from enjoying life? What message would you give that person?
Thank you very much. So first of all, we need to preach love and kindness. Yes. Love and kindness. Love and kindness at all levels. Just be kind to the next person because you do not know what their person is going through. Showing people kindness and love go a long way in giving them hope. They will give them hope and say, oh, so these people, they care about me, showing them empathy and affection that their life is worth living. There is hope. Once there is life, there is hope. That gives people courage. And then also validating people, non-judgmental approach. Do not judge anybody. Only God has the right to judge anyone. You do not judge, do not compare Mr. A's problem with Mr. B's problem. There are two different people who has walked two different routes to where they are today. So if anybody or you identify anybody having a problem, just be kind to them. Say nice things to them. Be supportive to them. And signpost them if you think it is getting out of hand to professional help. You know, as Africans, we are so faith grounded in terms of, well, yes, there is role for prayers and things that, but there's also role for professional help. It works. It works. So for the pastors and the clergymen or the imams that are listening to us, yes, you can pray for them, but get people to access professional help, to speak professionally, to help people that can help them identify and process their thoughts and the way they think. So if you have anyone, you can show them love, be kind to them, and then signpost them to appropriate services.
Yes, and to add, it's always important for family to come together when this person seeks the medical help, because family therapy is also fundamental when it comes to mental health issues. Also for you to understand and also to be able to cope and have the coping skills. And you can only get the coping skills when you hear it from a professional person who's going to empower you and equip you with tools. All right. Today we didn't really have many comments there, but Doc, before we close, like I said in the beginning, thank you so much for staying. I can see our viewers are still on. Like I said, it was my birthday on the 13th. I turned 40 years. It was my birthday. And because I am so passionate about mental health in men, as you all know, I've probably been talking about this in the past. I created a course, an online course for men to do a deep dive on themselves, to actually probably look at their childhood, what had happened in their childhood that brought them to where they are today. Some people, they're not even aware that they are depressed. So I'm taking it quite a deep delve on the course to actually look at boy child up to a man. These stories I share there, and also the expertise I brought in, the well-studied research work, and I'm hoping it will make a difference. I'm giving away 40 courses.
Wow.
Because I'm 40, Doc. I'm giving it out. I'm giving to 40 people to take, if they are ready to do a life transformation, to look at their lives differently moving forward. Like Dr. Sola mentioned, we're not going to do anything about COVID-19, what it has caused to us, but we can react differently. How do we respond to this COVID-19? How do we respond at our personal level, our professional level? How do we start living again? Because it's here to stay with us. We don't know. No one knows when it's going to end. But if you dive into this course, it might give you a different perspective on how to live life, general, how to relate with people around you, how to also heal. This is actually a course to start the journey of healing, and also to give you an insight of what's been happening in your life. So if you're interested, I'm going to drop my email address. I'm giving 40. I'm not going to just drop the coupons here, because I don't want people to miss. I want serious people who are looking for transformation. So I want you guys to email me. I'll be expecting 40 emails from you. First come, first serve. Like I said in the beginning, if you are looking for transformation, this course is for you. And if you are looking to look deep down in yourself and look inside yourself to heal, this course is for you. It has also changed my life as I was doing it. It was taking me back to my childhood stories. And in that process, I also had to deal with my own personal traumas, and I seek help. So this is a course that is for someone who is ready for transformation and growth. I'm going to drop my email address. And of course, we are always happy to see you guys here. Thank you so much for your loyalty, for coming back. We're going to bring these discussions to you. We love these heart-to-heart discussions. And as Dr. Sola mentioned, that I'm the new president of Black Mental Health Matters. We're going to take this to another level. We're going to start having in-person interactions. But of course, COVID-19 happened. But there's options like webinars, where we could have different rooms and have these intimate discussions. We are all about change. So stay with us. Stay with us. There's more development. There'll be more hosts too. We want to have variety. We're not only going to see my face only here. Dr. Sola will come one of these days and do this show. There's many more people that are interested. So if you're interested, let us know. I'm going to drop the email address here. you want to be part of this, you want to make a change. Like Dr. Sola mentioned, he said, what can you do? Like maybe it's about serving others. The greatest thing you can do for other people is to serve, because the person who does this for other people is the happiest. So maybe you want to start doing some work, bring it along. Maybe we have psychologists watching us here. We have brought psychiatrists watching us here, psych nurses. So please contact us so that we can work together. Thank you so much, Dr. Sola, for your time. I bless you and your family, and of course our viewers at home. Thank you so much for coming and watching us. We're coming back here next week, same time, same place.
Thank you. Bye.
Goodbye.
Bye.